Hi, I'm Helene Hubbard, and if you ask me why I became a nurse, I can tell you I honestly had never thought about becoming a nurse. I was fortunate to work for a summer youth employment program for 3 summers through our local county health department, and it was mostly a clerical position. However, I was fortunate enough that the director thought it would be a good experience for me to go out in the field with the nurses. They trained me to do hearing and vision screenings, and one nurse in particular would have me work with her during the children's immunization clinics. She had me draw up the immunizations, and she would have me distract the siblings while she administered them. And one particular day, she asked me if I had ever thought about being a nurse, and I just told her that's something I could never do. I was way too squeamish. She told me that should really reconsider because I'd be good at it. And I told her, Jan, I really am very squeamish. I could never do that. And she said, think about it. And so I spent the next month or so thinking about it. And when I left for college in the fall, I changed my major to nursing, and I did graduate with my bachelor's 4 years later, and took my first position in skilled nursing and did that for 2 years. And then after that, I went and worked in a major medical trauma center for the next year, where I worked on the medical floor, and I was ACLS and tele-certified. After that, my husband and I moved back to California, and one of the 2 local hospitals had a hiring freeze. The other offered me a position in extended care or rehab, and I really wasn't interested in doing that. And so I chose to commute a half an hour to a nearby town and try out a position in home health until something better came along. And I have been there since 1996, with the exception of trying quality assurance risk management for less than a year, which was not something better. And I went back to home health, where I have done everything from visiting nurse to case management to some quality assurance to staff training. And I love home health. The patient education is the best part of being a home health nurse, and that one-on-one time. And after United States University, I see myself working in primary care with a focus in wellness, nutrition, maybe weight loss, or in a wound clinic. Thank you.